thermoplastic molding materials that are solid at room temperature. And when subjected to moderate temperature rise, they become low viscosity liquids. By definition, it is a low molecular weight ester of fatty acids derived from natural or synthetic components such as petroleum derivatives that soften to a plastic state at a relatively low temperature. So this is the exact definition of what dental waxes are. Coming to the history, waxes, we cannot really check the history of waxes anywhere. I think all over the history of mankind, waxes have always been there. But in very ancient time, it was the beeswax and the secretions from the beeswax that were used in various forms, even as a medicament. But it was Taggart in 1907 who introduced the lost wax technique for fabrication of inlay into dentistry, and since then, waxes have remained as a big part of our work. What are the characteristics which we are looking at into the wax? We want them to be thermoplastic. We want them to have a good gloss. Though they are amorphous crystals, we want them to become soft when heated. And since they have long unbalanced molecular chains, which around the weight range of 400 to 4000, we want that when they set, the molecular chain become more stable. And they have very poor mechanical properties, but we want to improve their mechanical property. So before I tell you how we make the dental waxes, let me tell you about how we classify the dental waxes. That is most important. So first is according to the composition. You have the hydrocarbons, you have the esters, then you have the pattern wax, which are according to the applications in dentistry, impression wax, and the processing waxes. According to the origin, that is from where do we get these waxes, we have the natural waxes that first are the plant wax, the animal wax, the insect wax, the petroleum wax, and the mineral waxes. Then synthetic waxes are also made and they are also available for use. Now coming back to the composition of dental wax. Any wax which you have manipulated in your first year or your second year, it cannot be a one single constituent. It will be a product or mixture of all these waxes. You wax, synthetic wax, a natural resin added to it, gums added to it, and also because you require a specific color, coloring agents are also added to it. Coming to, because in the theory some waxes are asked even in the Viva, it is not possible for us to write about all the waxes, but the main waxes which we use in dentistry, I have compiled them and written some important aspect about them for you to understand. So first is the Carnauba wax, which is an ester derivative from a plant, derivative, and it is very hard and has an agreeable odor, but it decreases the flow at mouth temperature, but it gives a very good gloss. Next is another natural wax called as the Paraffin Wax. It is a petroleum derivative and it forms a major component of most of our dental waxes. It is a soft wax with a melting range of 50 to 70 degrees Celsius. But it renders our dental waxes more resistant to cracking and flaking, and therefore it is added to most of our waxes. Beeswax is another natural wax which is an ester derived from an insect. We all know about this. So it is a main component of the sticky wax and its melting temperature is 60 to 70 degrees Celsius. But it is very brittle at room temperature and becomes plastic at body temperature. It is used to modify the properties of paraffin wax. So when you have your base plate, you will have the paraffin wax in which this beeswax will also be added. Then we have this Ceresin, which is a typically white wax formed from a mineral which is found out of a mineral. It has a very unpleasant odor and it is used to increasing the melting range of the paraffin wax. What are the synthetic waxes that we use? You have the polyethylene wax and the polyoxyethylene glycol waxes. The polyethylene wax, the melting range is very high, 100 to 105 degrees Celsius, whereas polyoxyethylene glycol wax has a melting range of 37 to 60 degrees Celsius. Natural resins are also added to the waxes. They are complex amorphous mixtures having specific physical behavior. The sources are plant or tree exuded like the gum dammer and the insects like shellac. Natural resins are water insoluble. When mixed with waxes, they produce harder products. They are used in organic solvents to produce your cavity liners and copal resins. Then gums. Gums are derived from plants or animals. They are viscous, amorphous exudates that hardens on exposure to air. It forms a sticky, viscous liquid after dissolution in water. What are the desirable properties of dental waxes? First is the thermal property. Waxes are generally characterized by their thermal properties such as the melting point or range, softening temperature, thermal conductivity, and coefficient of thermal expansion. Coming to the melting range, which is a thermal property, waxes exhibit a melting range rather than a point. This property is influenced by the molecular morphology of all the waxes. At lower temperature, the molecular chains are entangled, which makes the wax behave as a solid. At higher temperature, chains become more mobile and eventually render the material fluid. Melting range can be modified by addition of different waxes. Softening temperature. Waxes exhibit solid to solid transition temperature, which is known as the softening temperature. Sorry. The waxes is converted from a relatively brittle solid to a much softer moldable material. Manufacturers can control the softening temperature by blending mixtures of various minerals, animals, and vegetable components. Thermal conductivity. Waxes are very poor thermal conductors. They must be maintained above the solid-solid transition temperature for long enough to allow thorough softening to occur uniformly. So methods of softening are very important. You either use a Bunsen burner or a warm water or wax annealer. Coefficient of thermal expansion of waxes is that waxes expand when subjected to rise in temperature and contract as the temperature decreases. This is highest among all the other dental material. Special precautions have to be taken to avoid distortion of the wax pattern because of this property. The mechanical properties are brittleness, flow, modulus of elasticity, and ductility. Brittleness. Some waxes require toughness, whereas some of them need to be brittle, depending upon their clinical application. Denture waxes, example like denture waxes, we require them to be tough as they have to hold the teeth also, and sometimes you have to remove them from the undercut without fracturing. Inlay waxes are brittle. We want them to be slightly brittle because we want them to fracture if they are in the undercut, because otherwise they will get stuck into the tooth. Flow. It is a measurement of the wax ability to deform under light forces and is analogous to the creep that we saw in the amalgam. Flow determines the moldability and the stability of the wax. Ideally, material should exhibit little or no flow at mouth temperature or room temperature so that they are not easily distorted. Last is the modulus of elasticity. Modulus of elasticity for all waxes decreases with rise in temperature. Carnauba wax has highest value and Beeswax has the lowest value between the temperature range of 23 to 40 degrees Celsius. Modulus of elasticity is a vital in hygroscopic expansion of casting investment in which the wax pattern is subjected. Ductility. Ductility increases as the temperature of the wax increases. Wax with lower melting temperature have a greater ductility at a given temperature than those with higher melting points. Blended wax with components that have wide melting ranges generally have greater ductility. All these properties are important when you are using the wax inside the patient's mouth or you are manipulating it in the dental lab. Coming to the different types of uses of wax. First is the pattern wax. Pattern waxes are of three types. You have inlay wax, baseplate wax, and the casting waxes. Inlay wax, you can use it directly or to make direct wax patterns or indirect wax pattern when you are using the lost wax technique for casting. Inlay wax is available in different colors. You have blue, green, ivory or deep purple color waxes available. Two types are available, medium and soft wax. The ideal requirement is that it should adapt closely, should have less coefficient of thermal expansion. It should not adhere to the wall. You should be able to carve it properly, and while casting it should not leave any residue in the mold. Also, the color should be dark so that you can have a good contrast. Like here you are seeing between the cast and the pattern that is made, there is a good contrast so that we can see the margins properly. Baseplate wax, also known as the modeling wax, is available in three types. You have type 1, type 2 and type 3. Type 1 is the soft wax which is used for building contours and veneers. Type 2 is the medium wax, and this wax is used in temperate atmospheric conditions. And type 3 is the hard wax which is used in conditions where the temperature or the weather is very hot. The uses of baseplate wax are, they are used to make the occlusal rims, they are used to hold the artificial teeth, they are used for extension of the impression trays if your impression trays is falling short, patterns of orthodontic appliances, spacers in the custom tray, or checking the occlusal clearance after tooth preparation. Next comes the casting wax. These are also pattern waxes which are available in wide variety of size and shapes. You have class A, that is the 28 gauge pink, class B 38 gauge green, class C ready-made shape blue. These casting waxes are used when you require a thin section of a cast partial denture to be made, for crown and bridge patterns, or for preparing copings or clasps required which we would want a uniform thin regions. Next are the processing waxes. Boxing, sticky, cardin, blockout, white and utility wax are the type of examples of processing wax. Boxing wax, it is used to form containers for pouring cast, to fabricate replacement of contacts. It minimizes the amount of model trimming that will be needed and better controls the thickness of the base of the cast. Next is the sticky wax. This is used for screwing the wax pattern or temporarily holding the individual units of a fixed bridge together. They can also be used for remounting the cast to the articulator. Cardin wax. Tooth cardin wax is used by the dentist and technician for general dental purposes and mainly used for attaching parts and in some soldering techniques, but it is also a very good material which we use to make so many artistic things in the class, and we all are looking for cardin wax in the free clinics. White wax, it is mainly used for making patterns to simulate a veneer facing, and the white wax, it improves the dentist's communication and the lab with the lab and eliminates the guesswork. Like when you are doing a full mouth smile designing case and you want the patient to see what you have done or what instructions you have given to the lab, you have to build it up in this type of wax, place it in the patient's mouth, show it to him. If you want any changes, you send it back to the lab again. So it's a good communication tool. Last is the utility wax, which is a modification of peripheral portion used for modification of peripheral portion of the impression trace or the lingual portion of bridge pontics to stabilize it and to form the head or the border of the preliminary and the final impressions. Impression waxes. These are used for correction of small defects in the impression. They are called as the corrective wax. They are also used for registration of the occlusal relationship between the two edges and arches, and it is called as a bite registration wax. These waxes have a limitation, that is that waxes have minimal surface hardness, so they can be easily deformed. If they are aggressively polished, then they will distort. During cooling, all waxes develop internal stresses due to low thermal conductivity and large amount of cooling shrinkage, which affects the dimensional stability of the waxes, which might be seen in the restoration or the appliance you give to the patient in the end. So to conclude, restorative dentistry cannot be completed without the use of wax, as they are used for some of the highest precision works in dentistry and have a specific, well-defined application.